Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. We want to welcome to our podcast today, Why Health and Harmony Beyond the Teeth? Well, I'm a dentist, but I do a lot more than just work on teeth. I learned a long time ago that the mouth is the window to health, and that as a dentist, I see patients, I'm looking in their mouth all of the time. Over the years, I've expanded my practice into breathing and wellness, and so it brings me great joy to introduce part two of our series that we started last week with Dr. Soroush Zaghi. For those of you that weren't with us last week, Dr. Zaghi is an otolaryngologist and ENT in Los Angeles, California. He's the medical director of the Breathe Institute, a great place where they treat patients. They also train doctors like myself. I did a surgery residence under Dr. Zaghi's direct mentorship, learning how to do surgical tongue releases on my patients. And I'll always be grateful and indebted to him for that. Dr. Zaghi at the Breathe Institute, they also do a lot of research and very high-end peer-reviewed research that is of the utmost quality, and we are changing the way that our medical profession looks at sleep breathing disorders, tongue ties, jaw development in children and adults. Dr. Zaghi has an impressive resume. He graduated from Harvard Medical School, completed his residency in otolaryngology at UCLA, and he did a surgery fellowship in sleep surgery fellowship at Stanford University. The focus of his subspecialty training is on the comprehensive treatment of tongue tie. We like to call it tongue restrictions, nasal obstruction, mouth breathing, snoring, obstructive sleep apnea, all of these that affect so many people in the United States and worldwide. And of course, being the founder of the Breathe Institute, Dr. Zaghi gets an opportunity to lecture all over the world and to teach many doctors. And we are honored beyond belief that he is here with us today, part two. So Dr. Zaghi, thank you so much for being here. We're so excited for the next 25, 30, 35 minutes to hear what you have to say.
Amazing. Thank you so much for having me, Hal. It was great to be here with you last week and again today. This is going to be such a great podcast opportunity for people to learn about so many issues that can affect their health outside of the oral cavity. And yeah, I'm the medical director of the Breathe Institute. It's been so fun working with you and helping to enroll some of our protocols into your clinic. I do want to give a shout out to my research team here. We meet every Wednesday, take the whole day off to work on a variety of different research projects that our community needs to push these concepts and fields forward. We've been at it for the past 4 or 5 years and have made tremendous improvements and successes in the way that we understand breathing, all right? And so what I'd love to do today is to talk a little bit about the mechanism of breathing, what's necessary, how we breathe, and then really talk about the role of the tongue in breathing. Wouldn't your viewers, Hal, or your patients be surprised to talk about the tongue as it relates to breathing? Is that something that is obvious or maybe not so obvious?
Well, I think maybe my demographics of my patients probably is not a good group to look at, because they're coming to me because they're aware of the importance. But in general, yeah, the tongue. What do you mean the tongue? How does that affect breathing? But before you start, just so you know how committed Dr. Zaghi is and how important this is. When he recently had he and his wife had their first child, little Maxim, who now is the proud owner of a Dallas Cowboy jersey, I might add. When you were in the room when Maxim was born, what was the first thing that you did when the doctor handed Maxim off to you? What was the first thing you did?
Grabbed a pair of gloves and I checked for a tongue tie. Sure enough, he had the tongue tie, and we got it treated day 2 of life.
Day two. That is amazing. So here we have a world-renowned otolaryngologist. The first thing that he checks on his newborn son is to see if he had a tongue tie. I asked him, I said, well, he asked me, what were the first thing you think I checked? I said, well, probably, 5 fingers on each hand, 5 toes. He said, no, he can live without a finger, but if he has a tongue tie, we're getting that treated. And sure enough, he did. Right. And he was barely 24 hours old and had his first surgery. Right. But at that age, they don't remember, and it affects the rest of their life.
Right. And the procedure was all of 12 seconds. 12 seconds while he's wide awake.
A 12-second procedure.
He spent longer getting his eyes checked and his hearing checked and things like that than the procedure. So, yeah.
Well, I'm excited because Dr. Corridor, my partner at the Stewart Center for Optimal Health, will be taking Dr. Zaghi's infant tongue tie release surgical residency starting. I think we're going out there in April. So we're looking forward to that. And so now we can treat here in Dallas. We can treat infants, children, adolescents, young adults, elderly adults. We'll cover the whole age range. So, Dr. Zaghi, we're looking forward to seeing you, by the way, when we come out. Why don't you start off? Last week when you were with us, we talked about obstructive sleep apnea, the importance of breathing. Tell us in general how is tongue related to breathing? That's going to take some people by surprise that those two are even related.
Totally. So first of all, in order to breathe well, you have to have a patent nasal passage. If your nose is blocked, you can't breathe. It's not going to work out. But that's only the first place along the continuum of the breathing passage. Because in order to breathe through the nose, yes, you have to have a patent nasal passage, but you also have to get the back of the tongue up in order to seal off the airflow from the mouth to the nose. All right. When the tongue is in a high position, the air will go through the nose and down the throat. When the tongue is in a low position, the lungs are trying to pull that air in, but you're fighting because half of the force will go through the nose and half will go through the mouth. And you need to put a lot more force, and you're going to have a lot more resistance to airflow. And that's a cause of upper airway resistance. So what we learned is that the position of the tongue is actually very important. The tongue should remain completely high in the roof of the mouth for ideal airway function, but in patients with tongue tie, sleep, and breathing disorders, the tongue more often than not is in a low position. And when the tongue is in a low position, that can perpetuate mouth breathing, sleep disturbances, and altered maxillary growth. So go ahead.
Well, last week we talked about the importance of nasal breathing. For our guests that weren't tuned in last week, they can go back and listen. But just briefly, give me the Cliff Note version on why mouth breathing is unhealthy versus nasal breathing.
Absolutely. So when you're nasal breathing, the nose is like an air conditioner for air. It moistures the air, it humidifies it, and what you're getting is very nice, warm, moistened, filtered air. When you're breathing through the mouth, you're bypassing the entire nasal immune system. You're getting dry, unfiltered particles that can go directly into your lungs. You're missing out on that opportunity to really filter and moisture and warm and moisture the air. So what happens when you're mouth breathing is that you can get dry mouth, dry lips, and that can cause inflammation inside the mouth and the throat, and is not ideal for your immune system.
So breathing, very important, the tongue's role in breathing, but it's also important in the development of the jaws. Talk a little bit about that, because that's very important. And underdevelopment of the jaws is directly tied to sleep disorders as well. And how does that all relate? So it all starts with the tongue not doing what it's supposed to do, right?
Yeah, so let's talk about that for a second. When you're breathing through the nose, the tongue is usually up in the roof of the mouth. But the only way to mouth breathe, the only way to do it is to drop the tongue down and open up the mouth. When you're mouth breathing, the tongue is going to be in a low position. Now, it turns out that the tongue plays a very important role in developing the maxillofacial structure. When the tongue is up, it's going to help grow the upper jaw. When the tongue is down, it's not going to do such a great job. Again, when the tongue is up, it'll work very nicely as a natural palate expander. It's like an orthodontic device. But when the tongue is down, it can't do its job to spread out the teeth and grow the upper jaw. And you can get problems with dental crowding and altered facial growth.
So children running around out there with crooked teeth, one tooth behind the other, that's not because their teeth are too big, is it?
No, it's more often than not because their mouth is too small to accommodate all of those teeth. And so we learned that when you have a tongue tie, the tongue is physically held in a low position and it's going to not be in a high position. So we have this case here, as I'm showing, where the tongue is being held down. And this is an adult patient, and consequently you can see all the dental crowding and underdevelopment. But these issues start early on. I'm so excited Dr. Corridor is going to be treating babies. Here's a baby with high resting tongue position. But then here's one with a tongue tie, and you can see how the tongue tie is keeping the tongue in a low position. And when the tongue is in a low position, the child's going to be a mouth breather. They're not going to have that force applied on the upper jaw to help grow it, and they'll get the problems with the dental crowding and other dental issues that you know all too well.
So this child we're looking at here, then that tongue is not going to be pushing up and out and forward, and therefore the jaws will grow or they won't grow as well as they should, right? They're not going to be as wide.
Right, yeah. When you don't have that force growing things, everything's going to collapse down.
Yeah.
So we talk about horizontal growers and vertical growers, and what we find is that when the tongue is up, things are going to grow in that direction.
Yeah.
But when the tongue is down, the face grows long. It grows downwards, and then it can push the jaw backwards, and they can cause TMJ issues and airway problems and other things like that.
That's very interesting because, and I'll just tell our viewers, I've been treating TMJ dysfunction in my office, in my practice for 25 years. And up until about 5 years ago, I didn't realize that I was, and met with great success. But knowing what I know now about the fact that the majority of TMJ issues are related to underdeveloped jaws and people with airway problems, it was a wonder to me that we met with the success that we did when I was dealing, against such a formidable opponent as not being able to breathe. So what is the importance of fully developed jaws in our overall health, including dental health and TMJ health and the rest of our body? Why are fully developed jaws so important?
Yes, so the jaws are the framework for the mouth and the tongue. If the jaws are set back and too crowded, then you're not going to have enough room in the mouth for the tongue. And if you don't have enough room in the mouth for the tongue, then the tongue can't do its job. It's like a 6-foot tiger in a 3-foot cage. It's cramped up in there and it's pushed back. And consequently, it can have effects on the way that you chew, the way you swallow, the way you breathe, your posture, and anything that affects the tongue can actually have severe ramifications on the entire rest of the body. So what we're really seeing is a domino effect where and a circle too, where the tongue is affecting the jaws and the jaws is affecting the tongue function. And it can domino in that when one of these things is the problem, it just all leads one back right to the other.
So it's a vicious cycle, basically.
Yeah, it's a cycle of oral dysfunction is what we call it, such that, as I'm showing on the slide here, that the restricted tongue mobility affects the tongue posture. The tongue posture affects the breathing, the oral-facial growth. The oral-facial growth affects the tongue space. This will lead to other compensations. And so it's a self-enforcing cycle where one affects the others and in a domino effect kind of pattern.
Yeah, my good friend, Dr. Felix Liao, who is the author of a book called 6 Foot Tiger, 3 Foot Cage. I'm sure you're very familiar with that. You referenced it. But Dr. Liao calls it impaired mouth syndrome, or IMS. And it really affects the entire body. And
it certainly does.
And the tongue is such a huge part of that.
Absolutely. Absolutely.
So Dr. Zoggy, everybody, that are listening to this, they may go to the mirror and lift their tongue up, and everybody has a tether or a frenum under their tongue. And the one you showed earlier was very obvious. I think anybody non-medical would say, yeah, that's a tongue tie. The tip of the tongue is tied down and can't move. And I think that's what most people think. What's the difference between a tongue tether, a normal tongue tie or frenulum that we have versus one that's pathological? And you can't always tell by just looking and having the patient raise their tongue up, can you?
No. So we do have screening tools to assess for that. In general, the patient should be able to lift up their tongue free of the floor of the mouth. So a tongue tie is a condition in which the tongue is physically tethered to the floor of the mouth. And so a lot of people with tongue tie simply can't lift up their tongue, and that's one way to look at it. But other patients, they learn to compensate. And the way they learn to compensate is that even though they can't lift up their tongue, they'll use their neck and their floor of mouth to compensate and push up their tongue. So they're really masking it. So again, a tongue tie is a condition in which the tongue is physically tethered to the floor of the mouth in such a way that it's causing a functional problem. But some patients are able to overcompensate for that problem by lifting up the neck and the floor of the mouth. And in that way, the patients can have problems with chewing and swallowing and optimal speech, oral hygiene, breathing, and maxillofacial development.
Give us a little physical anatomy lesson here. Why is the tongue being restricted like that? How is that affecting? I mean, we know it affects the growth of the jaw. You just said eating, and it can affect speech. But in your 40-year-old adult patient that comes into your clinic or my clinic, and we identify a pathological tongue restriction, what are some of the physical elements that they may be experiencing from that they don't even realize that that's what it's coming from?
Right. So in children, again, it could be speech, chewing, swallowing. But in adults, it might actually present as neck and shoulder tension or clenching and grinding, because the tongue is related to the rest of the body through a system of connective tissue known as fascia. And when the tongue is in a low position, it can pull on the fascia everywhere else so that you feel tightness in the neck and the shoulders. It can result in forward head posture and cause neck pain, shoulder pain, and other issues that can radiate out throughout the entire body.
Very interesting. Forward neck posture, as I talk to my patients a lot about that. If I held the cranium is about 8 to 12 pounds, average 10 pounds. If I held a bowling ball above my head, I could do that for a long time. If I held that bowling ball out another 2 inches or so, that would strain my shoulders. So forward head posture, talk to me a little bit about that and how that relates to shoulder, neck problems, chiropractic problems?
Absolutely. So, as we're looking on, let me pull up an image here. I'll hone in on it here. All right. So we have this child here who has who has his head in a forward position, right? But as your head gets forward, you need to balance that. Your shoulders need to kick in. Otherwise, you just tip over, right?
Right.
So the head comes forward, and then the shoulders, they need to kind of hold on. It's like having that bowling ball out in front of you. You can hold it here, but this is the leverage point. So as the head comes forward, you have more tension in your neck and shoulders, and that can radiate down the back and to the hips and to the knees and all the way down to the feet.
The body really is an amazing invention, if you will, creation. And when it's functioning at its highest level and it's in alignment, it's amazing what we can do, and it's amazing at how good we can feel. But it's like a domino, right? So like a domino effect.
Absolutely is. Absolutely is. It's how, when things are going well, other things are going to go well. And when things are going poorly, everything's going poorly. So that's what we're here to do, is to make people aware of these issues, make them aware of the importance of keeping the tongue up, the lips closed, with healthy breathing through the nose. But there's some patients who aren't able to do these things, and that's where we get into myofunctional therapy. Isn't that right, Hal?
Right, yes. For our viewers, and we are going to have a myofunctional therapy episode. We've got some great myofunctional therapists all over this country. So I don't want to get into that too much, but that basically is physical therapy and teaching your tongue how to, the proper neuromuscular response for your tongue. And that's one of the things I'm so grateful for you, Dr. Zaghi, is that you really hit it home and with me that myofunctional therapy is just as important as the surgical release of that restricted tongue. One without the other is like having ACL surgery on your knee with no physical therapy before or after. You just kind of let it heal on its own. And as we both know, that's not successful. So what are some, if patients out there are suffering from some of these issues, and maybe they do have a tongue tie or a restricted tongue, they're probably wondering, well, what do we do about that? So ultimately, we're going to work with a myofunctional therapist first. Then the tongue release surgery is going to be done. Talk a little bit about that, because to a lot of people, that just sounds like, oh my gosh, they're going to cut my tongue out of my mouth, or what does that involve? It's not nearly as bad as people conjure in their mind, is it?
No. So these procedures are done under local anesthesia while the patient's wide awake. We put a little topical anesthetic underneath the tongue, and then use a combination of scissors and laser with sutures to bring it back together. The procedure takes about 20 or 30 minutes. It's done while they're wide awake under local anesthesia. There's often only mild discomfort in the form of mild pain, and this is what the procedure kind of looks like before and after here. So basically, before the procedure, we put him through myofunctional therapy. We're seeing that he's having this connection from the tongue to the floor of the mouth. Then we put some topical anesthetic, excise that frenulum tissue, and use some sutures, and here's what it looks like afterwards. In well-qualified and skilled hands, this procedure goes very smoothly with minimal side effects or consequences, and the patient's able to lift their tongue. They can get freed, a lot of benefits, and then they have to continue the therapy for at least 2 months afterwards. The complications here can range from scarring, which is about 1 to 3%, and the scarring happens if they don't do a good job with the myofunctional therapy, or if there's a problem with the wound healing. There are other theoretical risks that you can have after tongue tie surgery, such as injury to nerves and glands and bleeding and things like that. But in well-trained hands, and I'm so glad that you took our residency and you could see the benefits of that, the complications are actually quite low if the surgeon actually knows what they're doing.
Yeah, I remember quite well back in October when we were doing in my office, and Dr. Zaghi was over my right shoulder, and he said, when I leave here after 2 days of guiding you through these surgeries, I want you to always hear my voice when you're doing these surgeries and everything that I teach you. And oh my gosh, it's wonderful, because if done correctly, these surgeries are minimally invasive. We don't leave a big gaping wound in the mouth. We do most of the releasing through the incision that we do. It's not a huge incision, and we suture it. So we have what we call healing by primary intention. So we get very, very little scarring, if any. And Dr. Zaghi's surgical course was one of the most amazing things I've ever done. So I have no doubt that if patients seeking this procedure and have it done correctly, it's a huge life changer. And what was amazing to me is watching you, Dr. Zaghi, do your surgeries in your clinic, and then experiencing the patient reaction in my own clinic with you there watching me. And since you've left, I've done many dozens of these procedures. Oftentimes the patients feel an emotional release, if you will, from the endorphins during the middle of this procedure. Talk a little bit about that, because it's quite amazing that when that happens.
Yeah, the fascia system actually contains a lot of signaling molecules, and for patients who have a lot of pain, they can have memories trapped in the fascia. And when you do these releases, there's like a sense of relief, a sense of release of the pain and the tension, and patients actually really enjoy it. A lot of times, they say how it feels like a wave of warmth, of good feeling that's coming across them. It's really incredible. You'd have to ask someone who experienced it.
Yeah.
But when you see it in a patient, it's really awe-provoking.
It's kind of like if you have a knot in a muscle and you go to a good massage therapist and they release that knot, you just feel it kind of melting away like butter. And I've not experienced that with my tongue. I am going to have a tongue release, and I'm going to be flying to LA to have it done with you. But I can imagine that's probably kind of what it feels like. And
you'll let us know.
Yeah.
You'll let us and you'll know once we do it for you.
Absolutely. Well, we're running out of time. Is there any last talking points that you want to share with our viewers before we go to our exit portion of the show?
Just want to remind people about the importance of keeping the lips together, keeping your tongue up, and breathing through the nose. These very basic things can have a profound impact on your sleep, breathing, development, overall sense of health and well-being. And good luck to you all as you guys learn more in this amazing podcast. Hope you guys learn some things here and have some opportunities to explore more.
Tongue up, lips closed, healthy breathing through the nose, right?
That's exactly right. That's exactly right.
That's the motto of the Breathe Institute and now the Stewart Center for Optimal Health. So if any of you guys want any more information about all of these subjects, all things tongue, breathing, jaw-related, craniofacial development related, you can check out thebreatheinstitute.com. You can check out the Stewart Center for Optimal Health.com as well. And we'll be happy to entertain any questions that you might have. As we do every week in our show, we end the show with some music. It's called Health and Harmony, Beyond the Teeth, for a reason, because health is harmony, but music is harmony for the soul. So I have my guests each week pick a song, and we play a snippet of that song, and they talk a little bit about it, what's important to them about that song, why they chose that song, why they love that song so much. So Dr. Zaghi, last week we had a great Michael Bublé song that was played at your wedding and had a lot of meaning to you as far as just life in general. Today, what do you have for us?
I have a song from you. It's by Felix John and Vise. It's called Close Your Eyes, and it goes, close your eyes and make a wish. And this is something that really touched me about a year ago during the quarantine. I mean, everyone can remember where they were when they heard that we have to shut down and come inside, and how overwhelming that felt. But this song came on, and it's something that I held onto me, and it's been really helpful to get me through this tough time, and I hope it's helpful to all of you guys, no matter what difficulties or troubles that you're experiencing in your life. You got to know that there's an answer for it, and we're here to help you. So I hope you guys enjoy this song.
Okay, let's listen to a little bit of this.
Close your eyes, make a wish. When life ain't easy, remember this. I wanna be with you. Just pick up the phone and I'm with you. I just called to make sure you're not giving up. Close your eyes, make a wish. When life ain't easy, remember this. Just close your eyes and make a wish. All the troubles in my face.
Oh, that's great.
It's really uplifting and inspirational.
I would add, close your eyes and breathe. Dr. Zaghi, thank you so much for being with us. We will have you again in the future, so keep doing the great work you're doing, and I will look forward to seeing you in a month or so out in your neck of the woods. So,
Terrific. Thank you so much for having me.
You bet.
And good luck to you guys.
Stay safe. This is Health and Harmony Beyond the Teeth with Dr. Hal. See you guys next week. Bye-bye.